63. A patient in the ED is being evaluated for heart failure. He suddenly develops dyspnea, the coughing of pink sputum, tachycardia and mild hypotension. What will the nurse do next after contacting the ED physician? A. Administer oxygen. B. Administer Lasix by 4. C. Increase the 4 drip. D. Administer morphine by 4. E. Place the patient in a side-lying position. A, B, D. The patient should be placed in a semi-Fowler's position, oxygen, Lasix and morphine delivered. As the patient is already in heart failure, administering extra fluid by 4 is contraindicated. 64. A patient in the ED complains of dizziness. He has a heart rate of 46 and a blood pressure of 80/50. What should the ED nurse prepare for? A. Defibrillation. B. Prolonged patient monitoring with the patient in the upright position. C. Transcutaneous pacing. D. Administering 4-digoxin. Answer C. The patient with unstable bradycardia is a candidate for transcutaneous pacing. 4-digoxin will further slow the heart rate and defibrillation is not indicated. As this patient is unstable, monitoring further is not indicated. Check all that apply. Answers. With the patient and alert the OR staff for emergency surgery. Do not give 4 fluids unless ordered. The patient should lie on his or her back or be in the Trendelenburg position. Answers. 65. A patient with a known abdominal aortic aneurysm presents with back pain and hypotension. Which of the following interventions should happen? List all that apply. A. Alert the OR staff for an emergency surgery. B. Stay with the patient. C. Give 1000 cc 4 bolus. D. Monitor the patient's vital signs. E. Sit the patient upright. A, B, D. The patient likely has a ruptured aortic aneurysm. As a nurse, you should stay. 66. The patient is in the ED with a hypertensive crisis. What should the nurse do in the way of intervention? List all that apply. A. Give a fluid bolus. B. Give an antihypertensive agent. 5 minutes. C. Monitor vital sign every. D. Have resuscitation cart handy. E. Prepare for defibrillation. B, C, D. A hypertensive crisis is an emergency situation. Prepare for the possibility of A. Resuscitation by having the resuscitation cart handy, monitor vitals at least every 5 minutes and give an antihypertensive medication per doctor's orders. 67. A patient with a swollen, painful calf suddenly develops dyspnea. What has likely happened? A. The patient has developed a pulmonary embolism. B. The patient is having an acute myocardial infarction. C. The patient is developing a deep vein thrombosis. D. The patient is having a hypertensive crisis. Answer A. The patient likely has a deep vein thrombosis that has dislodged and has traveled to the pulmonary vessels to form a pulmonary embolism. This is a medical emergency that can lead to sudden death. 68. Thrombophlebitis represents A thrombus without inflammation. B. An embolism without inflammation. C. An embolism with inflammation. D. A thrombus with inflammation. Answer D. Thrombophlebitis is a thrombus with inflammation. 69. An ED patient is found to have an elevated central venous pressure. What are the possible causes of this? A. Increased water retention. B. Hypotension. C. Anemia. D. Acute hemorrhage. Answer A. An increased CVP is caused by increased water retention, heart failure, or kidney failure. It is not caused by hypotension, acute hemorrhage or anemia. Answer D. Cardiogenic shock presents itself with hypotension, cold, clammy skin, decreased urine output and tachycardia. Answer C. In a stable patient with supraventricular tachycardia, carotid artery massage would be a good first step. If cardioversion is required, it should be synchronized. Lidocaine and epinephrine are not indicated. Answers. 70. Cardiogenic shock presents itself with A. Hypertension. B. Bradycardia. C. Increased urine output. D. Cold, clammy skin, 71. A patient presents to the ED with supraventricular tachycardia and a low normal blood pressure. What is the first thing you can do to relieve this? A. Unsynchronized cardioversion. B. Carotid artery massage. C. Lidocaine bolus. D. Epinephrine bolus, 72. Typical cardiac markers for acute ME include A. Troponin I. B. SGPT. C. CKMB. D. Bilirubin. E. Immunoglobulin. A. C. Both troponin I and CKMB are markers for an acute ME. 73. A patient is diagnosed with influenza and started on antiviral medication. What do you tell the patient upon discharge? Select all that apply. A. You are now not contagious for the influenza virus. B. Take the medications until you begin to feel better. C. You are not at risk for bacterial superinfections. D. You are infectious for up to 2 days after starting antiviral medication. E. Call your doctor if you have side effects from taking the medication. Answer, S, D, E. The medication must be taken until it is gone and you are contagious for up to 2 days after starting the antiviral medication. There is still a risk of bacterial superinfections. There are side effects from these medications that must be reported to the patient's physician. 74. An ED patient is prescribed theophylline upon discharge from the ED for asthma. What will you tell the patient about taking the medication? A. The medication must be taken at night. B. Do not eat chocolate, drink coffee or drink cola on this medication. C. Do not take along with a beta agonist medication. D. Do not take this medicine with beta blockers. Answer B. Patients on theophylline should avoid xanthine, containing food items including coffee, chocolate and cola. 75. A patient with asthma is discharged on a beta agonist inhaler and a corticosteroid inhaler. How do you instruct the patient to take the medications? A. Take the beta agonist inhaler first and then the corticosteroid inhaler. B. Do not take the two inhalers together. C. Take the inhalers both in the evening. D. Take the corticosteroid inhaler first, rinse your mouth and take the beta agonist next. Answer A. The patient should take the beta agonist inhaler first to open up the airways that will then be more able to absorb the corticosteroid inhaler. They can be taken together at any time during the day or night. Answers. Sedative effect of Benadryl and should not drink alcohol. Oral medication is available if the patient has recurrent symptoms. The patient can sleep if desired and can take corticosteroids concurrent with taking Benadryl. Answer B. Terbutaline can raise blood sugars, so it should be used with caution in patients who have diabetes. Mellitus 76. The ED. Charge. Patient is given Benadryl for an acute case of hives. What do you tell the patient upon select all that apply? A. Do not drink alcohol for the next few hours. B. Do not drive yourself home because Benadryl can be sedating. C. Do not sleep for 8 hours. D. Do not take corticosteroids with this medication. E. Oral medication can be taken at home if the itching recurs. A, B, E. The patient receiving high doses of Benadryl should not drive themselves home because of the 77. A patient prescribed terbutaline for asthma should be cautioned if they have which of the following underlying conditions? A. Hypothyroidism. B. Diabetes mellitus. C. Liver dysfunction. D. COPD. 78. The nurse is treating a patient with naloxone for an intravenous opioid overdose. The following equipment should be nearby. A. Paracentesis tray. B. Lumbar puncture tray. C. Foley catheter tray. D. Resuscitation equipment. Answer D. As the patient is suffering from an intravenous opioid overdose, the nurse should have resuscitation equipment standing by. 79. The patient is being discharged on a cough suppressant, which is not a prescription cough suppers. Santi. A. Tessalin. B. Robitussin AC. C. Robitussin DM. D. Codeine sulfate. Answer C. All but Robitussin DM are prescription cough suppressants. 80. The patient is recommended an inhaled nasal decongestant. What information should you share with the patient? A. They should not be taken with intranasal corticosteroids. B. They should not be taken for more than 48 hours. C. They do not cause rebound nasal congestion. D. They cannot be used with Robitussin products. Answer B. They should not be used for more than 48 hours because of a risk of rebound nasal congestion. They can be used with intranasal corticosteroids and Robitussin products. 81. Patients prescribed ipratropium for asthma should not take the medication if they have what condition? A. Diabetes mellitus. B. Peanut allergies. C. Coronary artery disease. D. Liver dysfunction. Answer B. Ipratropium is made from a plant substance that is similar to peanuts, so cross allergies can occur if the patient has a peanut allergy. 32. Infectious disease respiratory precautions should be taken if a patient is suspected to have all but the following: A. Influenza. B. Tuberculosis. C. Pulmonary embolism. D. Ebola. Answer C. Of those listed, only pulmonary embolism is not considered contagious while the others are contagious. 83. A 65-year-old male with a history of COPD presents with an exacerbation. Which of the following represent the likely presentation? List all that apply. A. Open mouth breathing. B. Hypoxia. C. Hypocapnia. D. Rapid respiratory rate. E. Bradycardia. Answer B. D. With COPD exacerbation, there is rapid heart rate, hypoxia and hypercapnia. 84. A patient with COPD requires a precise amount of oxygen to be given. What kind of oxygen delivery system should he have? A. Nasal cannula. B. Face mask. C. Venturi mask. D. Tracheostomy. Answer C. Only the Venturi mask can deliver a precise increased respiratory rate, pursed lip breathing, amount of oxygen and is suitable for those with COPD. 85. A patient has sustained a multiple trauma and is at risk for acute respiratory distress syndrome. Which is the earliest sign of this condition? A. Increased respiratory rate. B. Rhonchi inspiration. C. Use of accessory muscles to breathe. D. Wheezing on expiration. Answer A. The earliest sign of acute respiratory distress syndrome is an increase in respiratory rate. The other symptoms may come on later. 86. A person who has been intubated following a car accident has the high pressure alarm go off on the ventilator and absent right upper breath sounds. Which should be suspected first? A. Pulmonary embolism. B. Pneumothorax. C. Misplaced endotracheal tube. D. Acute respiratory distress syndrome. Answer B. The patient has a high likelihood of having a pneumothorax. If the endotracheal tube was displaced, it would normally result in an absence of breath sounds on the left rather than the right. A pulmonary embolism unlikely and acute respiratory distress syndrome would have different symptoms. 87. A patient has just been diagnosed with a flail chest. Which characteristic finding would the nurse notice? A. Dyspnea. B. Paradoxical chest movements. C. Cyanosis. D. Hypotension. Answer B. Paradoxical chest movements are characteristic of a flail chest while the other symptoms can be due to a variety of lung conditions and are not classic findings in flail chest. Answer D. The most characteristic finding in a pneumothorax is absent breath sounds on one side of the chest. Answer C. The patient likely has a tension pneumothorax. By removing the dressing, the tension is removed and the patient's tension pneumothorax will revert to a simple pneumothorax. Answers: 88. A patient is suspected to have a pneumothorax based on the following findings: A. Decreased heart rate. B. Fast deep respirations. C. Wheezing on expiration. D. Absent breath sounds on one side of the body. 89. A trauma patient with a puncture wound to the chest wall covered with an occlusive dressing. Complains of increasing air hunger and is suffering from hypoxia. The trachea is deviated. What should the nurse first do? A. Increase the oxygen. B. Use an ambu bag to ventilate. C. Remove the dressing on the puncture wound. D. Perform an emergency tracheostomy. 90. When a pulmonary embolism is suspected, the nurse should do the following. Check all that apply. A. Lower the head of the bed. B. Administer oxygen. C. Notify the ED staff and the rapid response team. D. Prepare the patient for an arterial blood gas. E. Ensure that N4 is ready for heparin infusion. B, C, D, E. All of the above should be done except that the head of the bed should be elevated. 91. A COPD patient is in the ED for pneumonia. He is hypoxic with hypercapnia. What should the oxygenation of the patient be? A. 100% oxygen by mask. B. 12. C. 4. D. 41/minute oxygen by mask. Answer B. A COPD patient who is already hypoxic uses the hypoxia as a drive to breathe oxygen. There will be a decrease in the drive to breathe and respiratory failure. 92. As a nurse, you are asked to give a patient Zofran, ondansetron medication. A. Nausea and vomiting. B. Paralytic ileus. C. Minoxidil L, minute oxygen by nasal cannula. Intestinal obstruction. D. Urinary retention. Answer A. Zofran, ondansetron. 93. As a nurse, you are asked to give the patient Imodium loperamide. The medication. A. Urinary retention. B. Diarrhea. C. Constipation. Y. Nasal cannula. Indicated for nausea and vomiting. D. Gastrointestinal bleeding. Answer B. Imodium loperamide I given for the management of diarrhea. If you give them 0 much. For what purpose are you giving the? For what purpose are you giving? Answer C. Hepatic coma results from elevated ammonia levels for which the treatment is lactulose that allows for the elimination of ammonia through the stool by increasing peristalsis. Answer B. When a patient has a prolapsing stoma. Edematous. Answer D. The patient with asterixis will have flapping of the hands when extending the arms as a finding of cirrhosis. 94. A patient presents to the ED with what is diagnosed a hepatic coma. What medication will you expect will be given? A. Imodium. B. Ammonium sulfate. C. Lactulose. D. Zofran. 95. A patient presents to the ED with a stomal prolapse from an ileostomy. What does the nurse notice? A. Sunken stoma. B. A protruding, erythematous stoma. C. A flattened stoma. D. A bluish discoloration of the stoma is protruding from the abdomen and is erythematous. An. 96. A cirrhosis patient has the finding of asterixis. How would the nurse elicit this finding? A. Have the patient lean over while sitting. B. Ask the patient to lie down and lift one leg. C. Have the patient protrude his tongue. D. Ask the patient to extend the arms. 97. A patient presents to the ED with a suspected perforated gastric ulcer. What is the most common finding? A. Rigid abdomen. B. Tachyarrhythmias. C. Diarrhea. D. Leg numbness. Answer A. The most common finding of a perforated gastric ulcer is rigid abdomen because of peritonitis. The other findings are not typical of a perforated gastric ulcer. 98. A patient with hepatitis has been found to have it because of eating contaminated food. What is the most likely type of hepatitis the patient has? A. Hepatitis A. B. Hepatitis B. C. Hepatitis C. D. Hepatitis D. Answer A. Of the different types of hepatitis, only hepatitis A is transmitted through contaminated food or water. 99. A patient has just been diagnosed with GERD, gastroesophageal reflux disease. The nurse tell the patient to avoid A. Peppermint. B. Coffee. C. Non-fat milk. D. Chocolate. E. Baked chicken. F. Fried chicken. Check all that apply. What foods should Answers: A, B, D, F. The patient should avoid peppermint, coffee, chocolate, and fried foods. The other foods shouldn't precipitate GERD. Answer B. The most common finding in hepatitis A is malaise. Pain, if present, occurs in the right upper quadrant. Diarrhea and black, tarry stools are not a consistent finding of hepatitis A. Answer D. The patient with acute cholecystitis will have right upper abdominal pain that radiates to the right shoulder. 100. Finding: A. Black, tarry stools. B. Malaise. C. Left upper quadrant abdominal pain. D. Diarrhea. 101. Ing. A patient has just been diagnosed with hepatitis A. What should the nurse expect as A patient is suspected to have acute cholecystitis on the basis of what findings? A. Left lower abdominal pain, radiating to the umbilicus. B. Right lower abdominal pain radiating to the umbilicus. C. Right upper abdominal pain, radiating to the back. D. Right upper abdominal pain, radiating to the right shoulder. Answer B. Pain from pancreatitis is usually severe and unrelenting in the upper abdomen, sometimes radiating to the back. 102. A. Severe, unrelenting pain in the lower abdomen, radiating to the groin. B. Severe unrelenting pain in the upper abdomen, radiating to the back. C. Burning, intermittent pain in the upper abdomen, radiating to both shoulders. D. Burning and aching pain in the right upper quadrant, radiating to the right shoulder. 103. Surgery. He suddenly vomits and experiences increased pain and distension of the abdomen. What nursing intervention would you do? A. Apply warm compresses to the right lower quadrant of the abdomen. B. Notify the ED physician. C. Give prescribed pain medication by 4. D. Give oral Tylenol with codeine as prescribed. Answer B. The patient has likely ruptured his or her appendix. The nurse should notify the ED physician and should not give pain medications, orally or by 4. Warm compresses are not indicated in this situation and might make things worse. A patient suspected to have pancreatitis has which of the common pain scenarios? A patient has been diagnosed with acute appendicitis and is waiting in the ED to go to. Answer D. The patient with the above symptoms probably has a ruptured diverticulum with peritonitis and proba. BLE peritonitis. 104. Is the most likely diagnosis? A. Diverticulosis. B. Appendicitis. C. Sepsis. D. Diverticulitis. 105. A patient has severe left lower quadrant abdominal pain, fever and a rigid abdomen. What? A 23-year-old patient has developed bloody diarrhea. What is a likely diagnosis? A. Diverticulosis. B. Acute appendicitis. C. Ulcerative colitis. D. Crohn's disease. Answer C. Ulcerative colitis presents with bloody diarrhea. The other three do not present with bloody diarrhea. Crohn's disease usually presents with diarrhea that is not bloody. NCLEX. Emergency